Hello friends, welcome back. We all know that even after COVID-19 vaccination, infection is possible. But if the infection is like common cold, we don't mind so much. But if we have to go to hospital because of the infection, then it's a matter of concern. So in today's video, I am going to talk about whether hospitalization is possible after COVID-19 vaccination. By now, we all also know that yes, hospitalization is possible. But what is the rate? Who are the most vulnerable people for hospitalization? We will understand all these things today. So stay with me until the end and subscribe my channel if you want more COVID updates. Remember that we are looking for hospitalized patients with confirmed COVID-19 infection after vaccination. A total of 969 PCR positive patients were taken in the study. Patients can be unvaccinated when they have not taken any vaccine yet, partially vaccinated when they have taken one dose of Pfizer or Moderna, which are two-dose vaccine, completed course when they have taken two doses of the vaccine in case of Pfizer and Moderna, and one dose in case of Johnson & Johnson vaccine but had not completed 14 days post final vaccination. Fully vaccinated when they have completed 14 days after the final dose. Among these 969 patients, they have divided the patients according to these four categories. 797, that is, majority of the patients hospitalized with SARS-CoV-2 were unvaccinated. 103 admitted with partial vaccination, 15 had completed course, and 54 patients tested positive even when they were fully vaccinated. From this bar, it might look that the completed course were less infected than the fully vaccinated course. I don't know the exact reason for this, but maybe the fully vaccinated people were not following the COVID norms while the completed course were following the COVID norms as they have not completed 14 days after vaccination. However, this is my assumption. I'm not sure about it. From the bar, one thing is clear that vaccine imparts protection, and that's the reason majority of the unvaccinated people were hospitalized. Another thing is that even after full course of vaccine, severe COVID is possible. But as you can see, out of 969, only 54 patients were hospitalized after full course of vaccination. Now let's zoom this part and see what is the status of the patients who were COVID positive even after full vaccination. So there are 54 of them, of which 25 were asymptomatic. You might be wondering, why did asymptomatic people come to hospital? It turns out that these people came to hospital for some other treatment but were found to be COVID positive upon testing. Similarly, 4 were mild, 11 were moderate, and 14 were severe, which means 25% of the fully vaccinated people can be severely ill. This can be due to various reasons like emergence of different variants for which the vaccine are not so effective, and also due to less or no immune response in this 25% of the patients, which can be due to different comorbidities. So next they zoomed into these 14 critically ill patients to understand the reason for their severity. It turns out that most of them were older, around 80 years of age. Most of them had severe illness, 4 were critical. 4 out of 14 patients were in ICU, 1 in mechanical ventilation, and 4 of them died. If you look into the table carefully, you can see that most of them had multiple comorbidities like overweight, cardiovascular disease, lung disease, malignancy, type 2 diabetes, or were on immunosuppressant drug. So it seems that age and comorbidity are two important factors for not getting much protection from post-vaccine COVID infection. There was one person who did not have any comorbidity but died. This table makes it clear that this vulnerable group might be eligible for booster shot so that they can mount their immunity and thus remain protected. Interestingly, the scientists also looked at which vaccine gave what kind of COVID severity after vaccination. Let's plot number of people on the x-axis and different kinds of vaccine on the y-axis. Red means severe or critical COVID, yellow means moderate, blue means mild, and white means asymptomatic. Higher number of people were critical with Pfizer BioNtech vaccine compared to Moderna and Johnson & Johnson vaccine. So to conclude, vaccine imparts good protection from severe COVID-19. However, elderly people and people with comorbidities are more vulnerable for severe COVID-19 even after vaccination, which makes it clear that more studies are required to understand what steps should be taken to get maximum benefit from vaccine. In the meanwhile, we should all follow COVID-specific behavior even after fully vaccinated and fight together.